We're here today with two employees of Frontier Health who work with school-based programs servicing secondary school children. And if y'all could introduce yourselves.
Hi, I'm Kaylee Murphy, and I'm our Director of School-Based Services for Frontier Health.
Hi, I'm Summer Say. I work in the Kingsport City School District offering mental health and behavioral intervention services.
Start off with what kind of situations do you deal with specifically relating to a parent or guardian or someone else who may have a substance abuse problem that is affecting a student, say at one of the elementary schools or even the high school? How does that present itself? How does that work? What happens, I guess, when you...
Sure, the school system through us as well, we're all kind of set up as a team and work collaboratively to address the needs depending on what those are per each individual child. Sometimes it's helping get other services involved. Sometimes it's offering the mental health counseling aspect of things. Sometimes it's just as simple as providing clothing and food and things along those lines.
And do you always know what the substance abuse problem is, if it is methamphetamine or if it is something else, or do you sometimes help the students without maybe not being able to fully figure it out?
Sometimes we're informed that there is a substance abuse problem in the family, but we very rarely know what that is. And there's sometimes we don't even have that information.
When you counsel or assist these students, what are some of the things that they experience, some of the effects of a substance abuse in their house or in their close family?
So some of these kids have things like anxiety, depression. Some of them have started to use, maybe not meth or something of that nature, but something over the counter, or we've seen a lot of vaping, things of that nature. There are all sorts of problems that can result from having parents or caregivers who are abusing substances, and just the trauma from that, overwhelms a child in many cases, and kind of inhibits their ability to function safely, and they constantly just are dealing with that. And so things like homework and concentrating at school, sometimes getting a good night's sleep at home if there are things going on there, all affect school performance, and then over a period of time, can affect them long term in other ways like brain development, and a lot of issues can stem from parents or caregivers using substances at home in an abusive way.
When this presents itself, I would sort of assume, and I don't want to assume, so I'm asking students who are maybe late for school or truant, who don't attend as often as they are supposed to. Is that sometimes a red flag that there's something going on? I know there can be other reasons, but is that
It's definitely one of the factors that gets considered with those situations, yes.
And one last question, a sort of an open one. What do y'all think could be part of a solution to help, not necessarily to the meth epidemic, because I don't know, that's probably beyond any one organization, but what would you think in Kingsport City Schools or other, y'all are also in Sullivan County and Hawkins County and others, what's something that would help just in general into serving these kids? What would make things better, I guess, if you say, well, you need more counselors in the school, more Frontier Health and other organizational counselors and whatnot, what would be I'm asking for the magic bullet if there is one.
I think in many cases we can always use additional mental health support in our schools. And just overall there's an employee kind of shortage at this time, just everywhere, not only in mental health, but we're definitely feeling the effects of that, and I know that our schools are feeling the effects of that as well. They are having difficulties hiring teachers and other school staff overall, and so I think having more support would definitely be helpful. And I also think, getting parents or caregivers who have those issues into services, and not just working with the child, but being able to get the parents involved and doing family therapy or getting their own treatment would definitely be helpful.
Yeah, I was definitely going to say expanding and building more of the family treatment programs that are starting to be in place.
And one last thing, and I know I said that before, but you'd mentioned earlier when I was talking with you before we started that the some students are a little hesitant to say that there's something going on at home that's bothering them because they don't want to get the parent or the guardian or the older sibling or whatever in trouble. How do you work through that? I mean, do you just say, we want to help you, and you're going to have to give us some information? I mean, it makes you sound like the police almost. And I know DCS, Department of Children's Services, is probably seen as the police. They are in a way, but they're there to protect the children.
I mean, we're not investigators, number one, so we just focus on building a good relationship, a safe relationship, and being a safe, trusted adult for each specific child that we might be working with, because, they're not going to disclose that something's going on at home if they don't trust you. So I think for us, that relationship piece is the biggest thing there, and we're not trying necessarily to get them to disclose anything, but just to be able to have a safe place to talk about whatever might be going on in their lives. But of course, we always talk with them right up front before we ever meet any kind of goals or form any kind of relationship about what we have to tell. Things are private other than, if you're not safe, or if you want to hurt yourself, you want to hurt somebody else. Those are things we have to tell, and so they know that up front. So we're not necessarily betraying trust there, because we do have to make sure these kids are safe, and we are mandated reporters if they do tell us something like that. But we try to work with the kids to say, this is not okay that this is going on at home, so we do have to report this and talk to somebody who can help in this situation to get your parents or your caregivers help, because they need that. So getting them to understand it in that way is usually the best practice.
I was going to expand on that and say, our first conversations with them about this are discussing keeping them safe, and that is our biggest concern for them, is keeping them safe, and in helping them get their needs met, and also helping them understand that these things aren't their issues, these aren't problems, they're just things that we need to address.